This is Dr. Dennis Lawrence. We're going to talk today about how to read a knee X-ray. Sometimes it's easy and sometimes it's a little harder. We're going to talk about a patient who came in today, which makes it a little harder. This patient brought in an X-ray from 2005. When you look at an X-ray, we have the long femur bone, which is in your thigh, and then we have the tibia and fibula. The tibia is the main bone in your shin. The femur and tibia connect, and in between there is a medial here and a lateral compartment. This is where your medial and lateral meniscus lies. This is where the medial and lateral. What we see here, and this is a weight-bearing view, is the amount of distance between the bones usually tells how much cartilage is left. And as we can see here, he has marked decrease in his medial space. This is advanced arthritis. But I also know this is a weight-bearing view. This is a sunrise view, and this is his kneecap. Call it a sunrise view because you're bending your knee and your kneecap pops up at the top. So we can see the space between his knee is still relatively preserved. There's early arthritic change on the surface and the undersurface of the kneecap, which is called chondromalacia. This patient is not your typical patient. He developed polio in 1953. I believe the vaccine was in 54. And so you don't usually see polio patients. So his left leg is paretic, and he has a knee and an ankle foot orthosis. So they actually surgically in the 60s did an open procedure on his right knee to make sure it didn't continue to grow, because he was going to be 6 feet by his parents' estimates. So he was going to have a right leg discrepancy due to the polio, so they actually stunted his growth on his right knee. So it's no wonder that years ago he had an open procedure and he has severe arthritis. But this is 2005. It's 13 years ago. So we want to see what it looks like today, because arthritis, by definition of the knee and any joint, is a progressive disorder, which means it gets worse with time. So when we're here and patients come to me for regenerative medicine and stem cells, we're trying to see how we can alter that paradigm or help fix their arthritis in a way such as reversing that or halting the progression. You can never make an arthritis patient teenage again, but we're trying to help with quality of life issues. And this gentleman has become wheelchair bound in the last year. He's progressively lost his ability to walk, and so now he not only has pain, but he's severely debilitated. So we're going to look at his 2018 X-rays now.